All right. Hello, everyone, and welcome back to the third video in this set of videos here on Unit 3. In this video, we're going to cover experimental design, the four pillars of design, and the three most important types of experimental design that you have to know for the AP exam. You are guaranteed a free response question from this unit. So being able to distinguish between an observational study and an experiment is paramount. Also knowing how to design a study, what is the best type of study, how do I implement all of these little things that go along with designing an experiment is going to be incredibly important. So let's jump into it and we can take a look at those details so that way we know what to expect. So for experimental design, we have four pillars that every good experiment needs to follow. The first of those being treatments randomly assigned to subjects. That order is incredibly important. I'm going to assign a treatment to a person, not a person to a treatment. What I mean by that, let's say we have two total treatments. It's going to be, you get the medication or you get the placebo. I'm going to stand in front of each person and flip a coin. If it lands on heads, they get the medicine. If it lands on tails, they get the placebo. I'm not going to stand in the medicine group and pull names out of a hat until it's full. So this order is incredibly important in your wording of your answers. If you mix that up, there is the possibility that you lose points. I have seen it some years on the scoring guidelines that they specify that the order needs to be a certain way. The second thing is that you have to have the comparison of at least two treatment groups. You do not need to have a control group necessarily. You can, and that's totally fine. But a control group is not 100% necessary. And the reason for that is if I just care if Advil works better than Tylenol, I don't need a group that gets nothing. So sometimes a control group makes sense, but it doesn't necessarily make sense in every single context. But you have to have at least two groups. That is the important thing. You have to have replication. And now, for the science people out there, I apologize. Replication in statistics is just having large enough treatment groups. That if I have 100 people in a study and two treatment groups, I'm going to try and get that as close to 50-50 as I can. The way that math people skirt the science definition of doing the experiment multiple times and getting similar results is by saying if I have 50 people in a treatment group, I'm really doing this experiment 50 times because each one of them counts as a trial. So remember, for the purpose of statistics, replication is just large enough treatment groups. And the last thing is control for confounding variables. And this one is a little bit more nebulous because it's a little bit harder to quantify what we're doing. But really the idea here is if you randomly assign and you have replication, that is the best possible thing you can do to help to control for confounding variables. Now, if you remember, a confounding variable is a variable that's related to your explanatory variable that affects your response variable, but we didn't control for it. And so what I mean by that is something along the lines of if you're trying to do a study on exercise and weight loss, but you don't control for someone's diet, it'll be impossible to separate the effects. If you have someone in the exercise group who also started a significant diet change, it will be hard to separate the effects of the diet or the exercise from their weight loss. And so we try to control for every possible outside variable. Sometimes these are also called lurking variables. That's another term that I've seen used, but the AP exam itself will use the term confounding variables. Now, in order to be considered a good experiment, you have to have all four of those things. If it's missing any one of those, it all falls apart. So those are the four pillars that you need. Now, when we get to our types of experiments here, the first type of experiment is a completely randomized design. The second type is a randomized block design. And the third type is a matched pairs. There are no bad experiment designs. And what I actually mean by that is, unlike with observational studies, we don't have names for a bad experiment. We just say that it's a bad experimental design. That's just what we say. And so, taking a look at a completely randomized design and what it is. All this is where we randomly assign treatments to subjects. That's it. It is the experiment equivalent of a simple random sample. We don't group by anything. We just flip a coin and say if it lands on heads, you're in group A. If it lands on tails, you're in group B. That is that. Now, some of the advantages, it's really easy. Really easy to do because I don't have to do any legwork beforehand. I just get this group of people in front of me and I come up with some randomizing technique and we move on. The disadvantages is the control for confounding variables. A completely randomized design works if you have a really homogeneous population. If I have all brand new golden retriever puppies that are all roughly the same age, the same weight, from the same breeder, a completely randomized design is fine. If you're dealing with people from different states and different backgrounds and different heights and different weights and different eye color and different hair color, this probably is not going to be your best option. But a completely randomized design could also be fine if we were dealing with 100 brand new iPhone 16s that just got shipped in from their supplier. Right? They all came from the same batch, were produced by the same company at about the same time. This is probably fine. But when you're dealing with people, a completely randomized design is typically not your best option. And so we move forward and we take a look at a block design. Now, the difference with a block design is we group people. So you can kind of see how observational studies and experiments parallel each other. Here, this is the experiment equivalent of a stratified sample. We're going to group people based on a common characteristic. If you're someone who's ever babysat before and you've had to give the children you're babysitting medicine, you notice that the dosaging is by weight. That is because of a block design. They blocked children by weight to find the effective dosage, because when you're younger, weight has a significantly larger impact on how much medicine you need than when you get older. And so we group people. Again, that characteristic should be something that we think is going to affect the outcome. And so if we're talking about medication in children, it's typically by weight. If it's medication in adults, it's typically by age, which is why you see often people over the age of 65, I believe, are recommended to get 2 doses of the flu shot as opposed to just 1. Again, by weight and by age is a very common way in medical studies of blocking people, right? And then within each block, we randomly assign treatments. So if I'm going to group people, let's just say by age, and I've got 20 to 29, 30 to 39, so forth and so on. In the 20 to 29-year-olds, I'm going to have half of them getting the medication and half getting the placebo. Same thing in the 30 to 39, 40 to 49, so on and so forth. The important thing about this, though, is that you only compare within each block. I'm not going to compare the 20-year-olds to the 90-year-olds. That doesn't make any sense, right? And that's exactly why, again, I keep going back to the same example. You see that if your child is 4 to 6 years old, or they weigh 40 to 44 pounds, they should be getting 10 milliliters of Advil if they need it for a fever or for a headache or whatever it may be, because that is what the study showed. They're not comparing the children who were 40 pounds to the children who were 60 pounds, because it doesn't make any sense. Some of the advantages, again, the biggest advantage for a block design is the control for confounding variables. Now, by grouping people based on that characteristic that we think has the influence, that in and of itself is a control for a confounding variable immediately. The disadvantages, though, is that sometimes it's difficult to have the replication you need, depending on the group of volunteers that you have. It may not be possible to block based on the thing you want, because maybe you only have 2 people who match a certain age or a certain weight or a certain height or whatever it may be. So sometimes the replication can be difficult. Now, the last type of experiment is called a matched pairs. And what this is where everybody gets both treatments. Now, how that works depends on the scenario. Typically, we say we randomize which one you get first. However, if you can give people both treatments at the same time, do that. For example, if we were testing like eye drop A versus eye drop B, I could randomize which eye gets which eye drop. Or if you remember the rain boot question, I can randomize which foot gets which waterproofing technique. So if you can do both at once, great. If that's not possible for whatever reason, then you just randomize which one they get first. The other place you will see this used quite often is with identical twins. So it doesn't necessarily have to be the same person getting both, but identical twins are genetically identical. And so they will use them often in studies like this because it helps to control for all of the confounding variables. You serve as your own control group in a matched pair study. Again, like I just said, the advantage here is that the control for confounding variables is at an all-time high. If I am someone who just doesn't respond to eye drops, then my difference in the end here is just going to be zero. It's going to appear as if they were equally effective for me, which they were. If I did this as a completely randomized design or a block design, I'm going to pull the average down just because I'm someone who doesn't respond to eye drops or doesn't respond to pain medication. So you serve as your own control group. It is the best possible scenario. The disadvantage is you can only do it if there's two treatment groups. If I want to compare Advil and Tylenol, this is great. If I want to compare Advil, Tylenol, and Aleve, I can no longer do a matched pairs. So once you get beyond two treatments, a matched pairs is no longer possible. And most importantly, matched pairs is the best experimental design if you can do it. So unlike observational studies where there really wasn't a best one, stratified was good, cluster was good, even simple random was fine. In this particular case, a matched pairs is the absolute best design if it works in your scenario. So these kind of go backwards, where matched pairs is the best, a block design is the middle, and a completely randomized is still good, but there are better options out there. So matched pairs is the absolute best if it is possible. And so blinding, another very important thing. We have two types, which is just single blind and double blind. But in a single blind study, it's just one group doesn't know what treatment the subject is receiving. Now, that could be the subject themselves or the person who is directly interacting with them. Typically, like in a medication study, it ends up being the doctor doesn't know. But there's also cases where the subject doesn't know, or cases where nobody knows, but that would be double blind. But in this particular case, one example of it would be like giving different test study strategies. I'm going to have one group use flashcards, one group use the computer, one group use a textbook. It's impossible for the subjects to not know what group they're in. But the person grading the test will not know what group you are in. And so that's one important thing to keep in mind with blinding, is that it is the people who are directly interacting with the subjects that don't know. Obviously, somebody has to know what group you're in. Now, with a double blind study, it's where both groups don't know. That being the subject and the person directly interacting with them. One example for this would be a medication study about like an anti-anxiety medication. The subject doesn't know whether or not they're getting the new medication or the placebo, and the therapist that's working with them also doesn't know. However, there's going to be a doctor or another medical group that's overseeing the study that will know who is getting the pill and who is getting the placebo. The reason for this is is that, again, it helps to control for confounding variables. If a therapist knows that you're getting the pill, they may treat you differently, even if it's subconsciously, than if they know that you're not getting the pill, right? They may potentially treat you more aggressively if they know you're not receiving the medication than if you are. And so this helps to control for confounding variables. These are my two types of blinding. And like I said, the purpose is it just helps to control for confounding variables. That is the biggest thing. Now let's take a look at some AP examples here, right? For this particular one, this is a lot to read. I just threw this up here to talk about when it says to describe a method for assigning 24 students to two groups of equal size, you can't just say randomly assign. You have to actually give a method, meaning I'm going to flip a coin. If it lands on heads, they go to this group and be specific. If it lands on tails, they go to the other group, right? I think in this case, it was a physical dissection or a computer program. So if it lands on heads, they're going to be in the group that does the physical dissection. If it lands on tails, they're going to be in the group that uses the computer. And then once one group fills up, everybody else goes to the other one. And that is totally fine. That is still random. Part B here about self-selection is that we no longer have random assignment, and so we lose that cause and effect. Random assignment is the cause and effect determiner, if you will. The other one, this is the question I was actually talking about earlier, the rain boot question. Here, describe a design. If you do not do a matched pairs in this question, you do not get full credit. So that's what I mean when I say a matched pairs is the best design. A matched pairs is the best design. A matched pairs is the best design. So in this particular case about waterproofing methods, it's very simple. You can flip a coin for each person. If it lands on heads, they get a right boot with the new waterproofing technique. If it lands on tails, they get a left boot with a new waterproofing technique. And we do that until one group has 50 people. It is that straightforward. And can this design be double blind? It absolutely can, because the people won't know. Because one particular thing, if you read the question closely, it says that it doesn't change the appearance. So the people won't know. And then the people who are then evaluating the damage also won't know which boot is which. But the company who is sending these out will. So I hope that was helpful, and I'll see you guys in the next one.